Hi, I'm Hitesh Goswami. I'm co-founder and CEO of Phobase Care Genomics. We are a precision oncology company based out of India. And welcome everyone to this wonderful afternoon for the Precision Oncology Asia talk number 5. As this talk is very special because this month we are celebrating Pink Month at Phobase Care to spread breast cancer awareness in the month of the October. Um, as you are aware that cancer often instills fear in mind of the patients and the caregivers, and often it is associated that it is end of the road if anyone is diagnosed with cancer. But that's not the fact, especially if cancer is diagnosed early, and which is the topic for today. Early detection is key to success. And for this, we have Dr. Indoo Ammbulkar, HOD, Head of Department Medical Oncology from HCG Hospital in Mumbai. She has more than 15 years of experience as medical oncologist, and she has treated patients with immunotherapy, chemotherapy, and her main interest lies in breast cancer, especially with her expertise in triple negative breast cancer. Along with that, we have Dr. Vivek Sharma, who is part of Dr. Indoo Ambedkar's team at FCG, who would be moderating the talk. And also, as special guest and speakers, we have two cancer survivors, Ms. Janice Martin and Ms. who would be sharing their journey and how they have faced one that they're talking about their life and their journey after being diagnosed with cancer. So from here on, I would pass on and let Dr. Indu Ambulkar take over the talk. Dr. Indu, I think you can now share your presentation and over to you.
Thank you, Hitesh, for the kind introduction. I'm happy to be the part. Am I audible?
Yes, ma'am. You are audible.
So I'll be talking about the breast cancer awareness, early diagnosis, the key to success. So I'll start with what is cancer. Okay. So what is cancer? So basically, cancer is uncontrolled division of cells resulting in an abnormal growth. That is what is seen in this picture. India's most common cancers are different in different sex of population. For men, the most common cancers are oral cavity, that is lip and oral cavity, followed by lung and stomach cancer. For females, it is the breast, which is the most common cancer, followed by cervix and other cancers. So you can see breast cancer is not only the commonest cancer in women, but the highest incidence of cancer if you see as a whole also. In this picture, you can see that in females, the most common cancer is breast cancer. So, what are the symptoms? I will be talking about the symptoms in general. Symptoms in general means what are the common symptoms where you can suspect cancer. Okay, so any unusual symptoms that are not normal for more than a few weeks should seek medical attention. Typical symptoms of cancer include, I'll be, I have given one acronym called CAUTION, CAUTION, to make it simple. So C stands for change in bowel or bladder habits. That means the person can have diarrhea or constipation or frequency of passing urine or retention of urine. A stands for a sore or ulcer that does not heal. Any non-healing ulcer can be a cancer. U stands for unusual discharge or bleeding, that means bleeding from any side. T stands for thickening or lump in the body, that means any lump in the body can be the symptom of cancer. I stands for indigestion or difficulty in swallowing. So, difficulty in swallowing can be the symptom of various diseases like throat cancer, or it can be food pipe cancer, or it can be stomach cancer. O stands for obvious change in wart or mole. We see moles are there in many people, but if they start changing the color and size, or if there is some abnormal discharge, then we should suspect cancer. There is one condition called melanoma, so that can present like that. N stands for nagging cough or hoarseness. So this nagging cough or hoarseness can be a symptom of so many diseases like lung cancer, throat cancer, or sometimes the lung metastasis, where the disease, the cancer is spread to lung. And apart from that, some unusual symptoms also we see. Like these symptoms are common symptoms: unexplained weight loss, unexplained pain in some part of the body, unexplained tiredness or fatigue, skin changes such as unexplained rash or unusual texture, unexplained night sweats or fever. So, what are the causes of cancer? So, I'll be just talking about the common causes for cancer. Cancers are primarily an environmental disease, with 90 to 95% of cases attributed to environmental factors and 5 to 10% due to genetics. So, what are the environmental factors? The common factors are diet and obesity in 30 to 35%, followed by tobacco use in any form, whether it is smokeless tobacco, that is chewing tobacco, or smoking tobacco, followed by infection and radiation. It is sometimes nearly impossible to prove what caused a cancer in any individual because most cancers have multiple possible causes. So I'll come to now breast cancer. As Mr. Hitesh has already told that we are celebrating Breast Cancer Awareness Month. So every year, October month is dedicated to breast cancer awareness. So what are the clinical presentations of breast cancer? The first and the common symptom is lump or thickening in the breast. Most of the time, we see patients who have lump in the breast for a long time and they don't come to the doctor because they feel the lump, there is no pain in the lump, and the lump keep on growing and they wait till the pain starts. But when the pain starts, it is already in a very advanced stage. So any lump in the breast in a female, we should suspect cancer and it should not be ignored. Then the next is discharge or bleeding from the nipple. There may be change in the size or contours of the breast, inversion of the nipple, change in the color or appearance of areola. There might be redness or pitting of skin over the breast, like the skin of an orange. In medical term, we call it as pewdy orange. These are some of the photographs I'll be showing where the patients have actually presented to me with cancer. So in this photograph, you can see there is a lump with skin and nipple involvement. You can see the nipple is abnormal and you can see the skin has become like orange. That is called orange peel appearance or pewdy orange. Now in this also you can see there is inversion of the nipple. The nipple has gone inside. Okay, this is the lump and the skin also has gone inside. The skin has also inverted. Now this is another picture. You can see this is the tumor in the breast, which is involving the skin, and there is one ulcer also over the tumor. This is another picture where the whole breast is involved by the tumor, and the whole breast has become red, inflamed. It is called inflammatory breast cancer. Now this is another picture. You can see because of the tumor in the lump in the breast, there is enlargement of the axillary lymph nodes, means lymph nodes in the armpit, which is also one of the common symptoms. Here also you can see there is a tumor in the breast which is involving the skin. So any lump in the breast, we should suspect cancer. And not only the lump in the breast, but there might be some changes in the nipple, and there might be some enlargement of the lymph nodes in the armpit. That also can be the symptom of breast cancer. So what are the risk factors for breast cancer? Breast cancer increases with age. Most of the time we see patients in their late 50s, okay, basically after menopause. So as the age increases, the risk of breast cancer increases. Women who started their menstrual period before the age of 12, or we call it as early menarche, or delayed menopause until after the age of 55 years. First pregnancy after 30 years of age. So basically, early menarche or late menopause or first pregnancy after 30 years of age means the amount of exposure to estrogen is more, then the chances of developing breast cancer will be more. Then comes the family history. If the family history of breast cancer is there, then it will increase the risk of developing breast cancer in a woman by 3 to 5 times. That's why one should not ignore the family history of breast cancer, and one has to be vigilant. If a woman has BRCA1 or BRCA1 gene present in her chromosome, there is an 85% chance of developing either breast or ovarian cancer or both in her lifetime. This is very important because nowadays we have the BRCA1, BRCA2 genetic testing available. So if there is a family history of cancer, and if the person is BRCA gene positive, then the chances of developing breast or ovarian cancer will be very high. And the other causes can be lack of exercise, smoking. So in India, 1 in 22 women suffer from breast cancer. So this is a very important, very significant number. And basically every single woman should be aware about the breast cancer. So you can see in this slide that in early stage, the survival is very high. If you see stage 1, up to stage 1, it is almost 100% survival. But as the stage increases, the survival goes down. If you see the distribution of percentage as per the stage, then as compared to the Western world, the percentage of advanced stage is more as compared to the Western world. And that's why the survival also is lesser as compared to the Western world. In the Western world, the screening programs are very aggressive, and the screening program is there in the government schemes also. That's why the early detection is very high in Western world. So what is the importance of early detection? Early detection means less invasive treatment, less trauma, less pain, less cost. If the breast cancer is detected in the early stage, it is curable. That is what I have shown in the last slide. If the cancer is detected in the early stage, then the treatment is also, lasts for a very short period of time. Like patient can just undergo surgery and just maybe few cycles of chemotherapy and that's it. Patient may or may not go for hormone therapy. That all again depends on the hormone receptor status. But as the stage increases, the duration of treatment also increases and the survival also decreases. That's why early detection is very important. Now comes to screening. So why is important? Screen is, Screening is important to diagnose the breast cancer in early stage. As I told you, if the cancer is detected in the early stage, the survival is very good. So can we do some screening facilities, like if do we have any screening facility available? Can we detect in the early stage? Yes, it is possible. It is possible to do the screening by these three tools. First is mammography, second is breast self examination, and third is clinical breast examination. So I'll talk about the breast self examination, which can be done by the woman herself. It should be started in early 20s. So you don't have to wait for to become 30 or 40. It should be started as early as in 20 years of age. You can notice the changes by knowing how the breast normally look and feeling the changes in breast. That is called breast awareness. By choosing to use a step-by-step approach with a breast self-examination, using a specific schedule to examine the breast. So, if you examine your own breast time to time, you can see the changes happening in your breast on a regular basis. That is the best way to screen. When to do breast self examination? If in a menstruating woman, 7 days after the menstrual cycle, in menopausal woman, same day of each month. So every month it should be done. In pregnant woman also it should be done same day each month, again once in a month. And uh, in breast self examination, one has to examine all breast tissue. So how to do the breast self examination? So it is there is a technique of doing it. First by looking, then second by touching, and third while lying down. So by looking, stand before a mirror and look at both the breast and nipples, once with both the arms beside your body, once with both the hands on your hips, and once with both the arms raised and arms behind your head. So these three different positions you have to stand in front of the mirror and look for both the breast and nipples. Now the second method is by touching. Raise your left arm, use the pads of your 3 or 4 fingers of the right hand to examine your left breast. Repeat on the right side. Means the same method has to be repeated on the other side. Once in line up and down your breast from outside to inside. Okay, from outside to inside. Once in circles around the breast, making smaller circles towards the nipple. Once in wedges, starting from outside towards nipples and back again. Now the next method is while lying down. Lie on your back, left arm over your head and a pillow under your left shoulder. Examine your left breast with your right hand as described before. Repeat for the right side. This position flattens the breast and makes it easier to examine. You have to examine the lymph nodes also. Place your left hand on your waist. With your right hand, try to find enlarged lymph nodes in the left underarm area and around your left collarbone. Repeat on the right side. An enlarged lymph node feels like a corn kernel or like a bean. Okay. This is another picture showing the same thing which I had discussed just now. So look for any changes in size, shape, contour, dimpling, redness or scaliness of the nipple or breast skin, nipple discharge, inverted nipple. You have to look for all these changes in breast, both the breast, first on the right side or as per your convenience. Examine each underarm while sitting up or standing with arms slightly raised. Now I'll come to clinical breast examination. So it is often done during regular medical checkup. A clinical breast examination should be performed by a healthcare provider with well trained in the technique. So it can be a doctor, it can be a nurse, or it can be a female technical staff, but the person should be trained in clinical breast examination. Now the next mode of screening is mammography. Mammography is the process of using low energy X-rays to examine the breast. Mammograms use doses of ionizing radiation to create images. It is used for diagnosis and screening. The goal of mammography is early detection of breast cancer through detection of mass or tumor and or microcalcification. So mammography is nowadays easily available. I think in most of the cities it is available. It is easy to do also, and it should be done on a regular basis. This is how the procedure is done. And this is how the pictures are seen in the mammography. This is the picture showing the microcalcification. This is the fibroadenoma. This fibroadenoma is usually a benign lump. It's usually it is not a cancerous tumor, but it is a benign tumor that also is seen in many females, but it doesn't harm the female. This photograph is showing a cancer. Okay, so by mammography we can detect whether there is a cancer or non-cancer. That means benign tumors also can be detected in mammography. Sensitivity declines significantly with mammography with increasing breast density, and the risk of breast cancer is higher in women with dense breast. So whenever the breasts are dense, the mammography may not be the investigation of choice, but we may have to do some other investigation. So if there is a, so there are other methods also. One is called sonography. So it is useful in detecting occult breast tissue in the dense breast. Another test is available called MRI. It is explored in women at high risk and in younger women, especially in dense breast. And it is advisable to do the MRI in patients who are having strong family history, and especially in women with the BRCA1, BRCA2 mutation. MRI found to be very highly sensitive. So what are the pathological tests? If there is a lump detected in the breast, what are the other tests? How to proceed further? There is one test available called FNAC, or fine needle aspiration cytology. It is a thin needle. A thin needle is put in the breast lump to aspirate the tumor cells. And another procedure is available called biopsy. It is a procedure which involves removal of a piece of tissue by needle or excision of lump to analyze under the microscope. So by removing the cells by FNAC or removing the tissue by biopsy, we have to send the sample to the pathology lab so that it can be seen under the microscope whether the tumor is malignant or cancerous. What are the treatment options available for breast cancer? In the early stage, the most common treatment is surgery. The surgery can be there in the form of removal of the breast or breast conservation. If the tumor is very small, the whole breast, there is no need to remove the whole breast, but we can conserve the breast only by removing the lump. The next treatment option is chemotherapy. Chemotherapy is usually given in early stages as well as in late stages also. And the advantage of giving chemotherapy is it prevents further recurrences. Radiotherapy is usually given by a machine, whereas the rays are given to either the breast or the chest wall after surgery. Radiation is also given to prevent the further recurrence. Hormone therapy. Hormone therapy is usually given in the tablet form, whereas the hormones receptors are positive on the breast tissue. We call it as estrogen or progesterone receptors. Next is targeted therapy. So targeted therapy is usually decided on the basis of specific markers on the tissue, and then we decide the targeted therapy. It can be there in the form of injection or tablet. Chemotherapy has a major role in the treatment of breast cancer. It increases the long-term survival rate. The toxicity is minimal with latest medicines available to treat the side effects like vomiting, acidity, neutropenia, or oral ulcers. It is very safe to give chemotherapy nowadays. Patient takes the chemotherapy on the daycare basis and they are doing their routine work while cycles are going on. So one should not get afraid of chemotherapy. There is one a technique available called scalp cooling to prevent chemotherapy-induced alopecia. Alopecia means hair loss. So there is one device available to prevent the hair loss. This is the device which is put on the head of the patient during chemotherapy to make the scalp cool. It reduces the blood supply to the hair follicles, and to some extent hair loss can be prevented. So, can we prevent breast cancer? To some extent, yes. The important thing is to maintain a healthy body weight, do the regular exercise, eat healthy diet, and aggressive screening. As obesity is one of the risk factors, it is very important to maintain a healthy weight. Include physical activity in your daily routine. Maintaining a healthy weight may reduce the risk of various cancer, not only breast cancer, but there are so many cancers which can be prevented by maintaining the healthy weight. These cancers can be lung cancer, breast cancer, colon cancer, liver, pancreas, stomach, or kidney cancer. Include at least 30 to 40 minutes of daily physical activity or any type of exercise. It may be brisk walk, jogging, cardio, weight training, or combination of these. So, exercise is very, very important to maintain a healthy weight and maintain healthy lifestyle. Eat healthy. Diet high in vegetables and fruit and low in sugar, refined carbohydrates and fatty food. So eat plenty of fruits and vegetables. Base your diet on fruits and vegetables and other foods from plant sources such as whole grain, nuts, and beans. Fruits and vegetables are the best sources of antioxidants such as beta carotene, vitamin C, vitamin E, selenium. Plant-based food have some cancer-fighting qualities also. So you have to eat healthy diet to maintain the healthy lifestyle. Don't smoke. Long-term smoking is associated with increased risk of breast cancer. So smoking not only causes the breast cancer, but there are so many other cancers which can be the cause, which smoking can be the cause. Like some of the cancers are lung cancer, then throat cancer, oral cavity cancer, then liver cancer, then kidney cancer, stomach cancer. So there are so many cancers which can be related to smoking. So it is very important to stop smoking or don't start smoking. Breastfeeding: women who breastfeed their babies have a reduced risk of developing breast cancer later. Now come to genetic testing and counseling. Genetic testing is also very important nowadays. So we have the BRCA testing available. An estimated 0.25% of the general population carries a mutated BRCA gene, or about 1 out of every 400 people. The genes are inherited. That's why knowing the family history is important in breast cancer risk. If one of the parents has BRCA mutation, there is 50% chance of inheriting the mutated gene. That's why BRCA status, to know BRCA status is important. So who should go for BRCA testing? It is recommended that people with a high risk get tested for BRCA mutation. A person could be considered at high risk for BRCA mutation if they have the family history of breast cancer diagnosed before the age of 50, male breast cancer at any age, multiple relatives on the same side of the family with breast cancer, multiple breast cancers in the same woman, both breast and ovarian cancer in the same woman, history of ovarian cancer, triple negative breast cancer. Triple negative means where the estrogen, progesterone, both receptors are negative, and HER2 receptor is also negative. So these are the indications to do the BRCA testing. Family history with following: family member with known deleterious genetic mutation related to increased breast cancer risk. First or second degree blood relative who meets any of the individual criteria. Third degree blood relative with breast and or invasive ovarian cancer with two or more close relatives with breast and or invasive ovarian cancer. So it is a blood test. The BRCA test is basically a blood test. So if there is a BRCA1 positive, so there are two mutations available seen in the breast cancer. One is BRCA1 and another one is BRCA2. So if in the breast cancer in an unaffected woman up to the age of 80, if BRCA1 is positive, positivity is seen in 60 to 90%. And BRCA2, 40 to 45 to 85% chances of breast cancer. Woman with breast cancer up to 50% chance if there is a woman with breast cancer in one breast. Lifetime risk of a new breast cancer in other breast, it is 5-year risk of new breast cancer. The chance is up to 10%, and 5-year risk of new breast cancer, the chance is up to 5 to 10% in BRCA2 positive. Ovarian cancer, if it is BRCA1 positive, then the 40 to 60% risk increase from age of 40. If BRCA2 is positive, then the 10 to 30% risk increases from mid 40s. So this is the famous case of Angelina Jolie, where she has undergone bilateral mastectomy. Okay, because there was a strong family history of breast cancer. Basically, her mother had the disease. That's why she has decided to undergo bilateral mastectomy. So she has set an example actually, in the society, that she has taken this BRCA testing so seriously that she has undergone prophylactic bilateral mastectomy to reduce chances of developing breast and ovarian cancer. So I'll end my talk by giving few messages. Maintain a healthy weight, very, very important. Do regular physical activity, any type of exercise for 30 to 40 minutes. Eat healthy diet with plenty of fruits and vegetables. Know yourself, your family history, and your risk. Very, very important. Don't ignore the symptoms. If you have any symptom, especially lump in the breast, you should not ignore. You should definitely go to the doctor and get it checked. Have regular checkups and cancer screening test. Breast cancer can be curable if detected in the early stage. So these are two photographs of patients whom I have treated, and both the patients you can see the hair growth. This hair growth patient has got it after completion of treatment. So the females who are having breast cancer should not get afraid of receiving chemotherapy, because the hair loss related to chemotherapy is very temporary, and most of the patients they become absolutely normal and they recover completely. Thank you so much. किसको बात
Thank you, Dr. Indoo. Thank you so much for such an informative talk. I would now like to request Ms. Janice to share her story along with also. Ms. Janice, Ms. Faida, would you like to go? Ms. Janice, if you'd like to go first.
Okay. Um, Hello, everyone. I am Mrs. Janice Martin, a triple negative breast cancer survivor. I'm not here to tell you what cancer is, but I would like to share my journey as a survivor. Um, I was detected with carcinoma of the right breast on 6th April 2016 through a biopsy report and mammography. It all started in March 2016. I was getting myself treated for a fungal patch on my breast, which was there for quite some time. And not knowing, it was a sign for me to know that I had a lump in my breast, nearly 3.5 centimeter, T2 or stage 2B. When I received the biopsy report and found the lump to be positive, I broke down physically, but not mentally. I gained courage and told my family members about it. I assured them that everything will be fine. I told them that I am lucky that it is just cancer and not hemophilia or HIV or any other deadly disease. The next step that came to our mind was to look out for the best doctors in town. While we visited many doctors in Mumbai, we came across Dr. Nagendra Paravatani, oncosurgeon, and Dr. Indoo Ammbulkar, oncomedical at Seven Hills Hospital. I thank God for meeting the right doctors at the right time. They guided me to do the right tests to diagnose my cancer for the right treatment. They asked me to do a genetic test to get the right guidance throughout my treatment.
Hitesh, I think there is a network problem.
Yeah, I think with Janice, we lost the network over here. Maybe we can request Miss Walid in the meantime to share her journey. And as soon as the Janice gets a network back,
Hello.
we resume the. Hello?
I think I've been. Hello.
Miss
Hello.
Janice, we can
Yes.
hear
Will I
you.
start again? Yeah.
Yes, we can hear
So
you.
sorry. I thank God for meeting the right doctors at the right time. They guided me to do the right test to diagnose. Hello. They asked,
Yeah, Miss Janice,
guided
we
me
can hear
to,
you.
yeah, sorry. They guided me to do the right test to diagnose my cancer for the right treatment. They asked me to do a genetic test to get the right guidance throughout my treatment. The test helped them to decide my line of surgery and the number of chemotherapies to be given. A mastectomy was conducted on my right breast, along with the removal of my 3 lymph nodes. Dr. Nagendra was my oncosurgeon. Then Dr. Indoo played the main role in deciding the line of medical treatment and the number of chemotherapies needed. Till today, I thank Dr. Indoo for the right decision she took for me. As I said in the start, I am triple negative breast cancer survivor, in which the ER, PR are negative. It is a rare case. Only chemotherapies help us. There are no proper oral medications for it. I go for my proper follow-ups to Dr. Indoo, who has been guiding me all the way. I am living a normal and a happy life. Family support is much needed, which I got in abundance. Above all, a positive attitude leads to a positive lifestyle. One should quite often perform self checks or examinations or do a mammography for early detection of cancer so that it can be treated on the right time. Never neglect any symptoms, as Indu ma'am has just mentioned. Life is full of challenges. The one who comes out of it is positively is the winner. Never give up. Do not forget, happy souls live longer. If Dr. Indu would have not given me the right treatment, I would have not been called a survivor. So trust your doctor. She knows the best for her patients. If we doubt our doctor and the line of treatment, our soul will always be unhappy, not forgetting the challenges one has to face financially, physically, and mentally. I always thank my caretakers, that is, my family members. We as patients are confined to the bed during treatment, but they are constantly on a run, trying their best to give or save our life. Remember, if you smile, they will smile. I would like to thank Dr. Indu because of her efforts on me. I'm on this platform today as a survivor. Thank you, Dr. Indu. God bless you always.
Thanks, Ms. Janice Martin, for sharing your journey. I think the two
Thank you,
take-home
Hitesh.
messages over here is that life is full of challenges, right? And one who
True,
comes out positive is the winner. And the second and the
true.
most important learning for all of us over here is that trust your doctor. I think
That's very
that
true.
goes a long way in terms of because till the time you don't believe someone who's treating you, they are going to do their best, right? So trusting your doctor is very, very important. That's the message we would like to take on from here. And thank you so much for sharing your journey. Now, I would like to
Thank
request
you.
Miss to please share her journey with all of us. You are on mute. If you can unmute yourself. I think there seems to be some. Yeah. Can you hear us?
Yeah.
Fantastic. So please go ahead.
Okay. So my name. The Yeah, I am a cancer survivor. The word itself a big scary in our life. We thought it's a cancer. It's a very dangerous diseases. We might be. It is not recovered. So in mind lots of confusion was there. So but somehow I treated in Fortis hospital. Only I heard about the cancer. I doesn't know the symptoms of breast cancer. I have not seen the patient also. Only I have seen the patients, the treatments in television or etc. And neither in our family. Mine is the first case in entire family. So I didn't know about the treatment, the side effects, nothing. So the treatment is new. This disease is new to me and also my entire family. But my family supported a lot. My husband, my in-laws, my mother's side. So and moreover, my doctor's team, they supported me, they encouraged me, make me strong. My surgical oncology team in Fortis Hospital, Sandeep Nayak sir, Sridhar sir, and my chemotherapy, Sudesh Babu, Sneha ma'am, and radiation therapy team. They played a very great role in my this this treatment. Hello.
We can
Yeah.
hear you.
So they should know the symptoms of this one cancer. What are the symptoms? Then only they can know, they can go for treatment. They go for examination, self-examination. That's all. Because I don't have any symptoms. Like I am a healthy person. No weight loss, no irregular periods, no tiredness, no weakness. So I didn't know what are the symptoms. Suddenly, when I read about some pamphlets in symptoms, then next day I went for all the test and all. Then third day the surgery was done. February 7th, 2020. So then after surgery, 1 month, then chemotherapy, 6 cycles of chemotherapy. Then after that, radiation, 25 days of radiation. And now radiation has stopped. I am on hormonal therapy. So I'm taking tablets daily. So there is nothing to worry in this treatment. So we have to be strong enough. We have to be mentally strong, physically strong. Sometimes we may not be physically strong, but we have to be. Yeah, these 6 cycles of chemotherapy, it's a very hard treatment, I say. Because lots of up and down in our systems, digestive systems, mentally, lots of up and down. So we have to be strong. Yeah, I know how we have to fight this. Yeah, that's all.
Thanks, Ms. for sharing your journey. It's very inspiring, both your and Ms. Martin's journey. Thanks for sharing with us. And again, I think one of the things to take away from here is that cancer can be very overwhelming for both the patient and the family members, because most of the times it's the symptoms are
Yeah,
new, everything is very new, and it's very important not just the patient but the caregivers, the family members, to be very supportive and be strong along with the patients throughout the journey. And again, I think the emphasis is that doctors play a very important role, and please trust your doctor when they are suggesting the treatment. because that is the one most important thing that will help you get over these difficult times. So thanks again, Ms. Janice, Ms. for sharing your journey.
Since I'm a very healthy person,
Hello. Yeah, Dr. Vivek, if you can put across the questions that we have for Dr. Indoo to answer. I think we just have now 10 minutes more.
Okay, now we'll take some questions from our audience. Why avoiding breastfeeding increases breast cancer risk? This question is from one PhD student. Hello.
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 Hello?
Hello.
Yeah.
Dr. Vivek, there seems to be an echo in your voice. So the question, can you just put it again?
Yes, okay. Why avoiding breastfeeding increases breast cancer risk?
Why avoiding breastfeeding increases
Breast cancer risk.
Yeah.
Yeah, so basically this is estrogen dependent cancer. So there will be more and more exposure of estrogen in the breast. That's the reason. And to some extent, the level of estrogen can be reduced if the woman is breastfeeding. And that's the reason one can, prevent the breast cancer by breastfeeding.
Okay, thank you. Next question.
Okay. Just like the second question is like just like female, should males also doing regular screening? And
So
who should do it?
I'll just repeat, Dr. Indu. So just like females, should males also be doing regular screening? And
Yes.
who should do it and how often they should do it?
Yeah. So, yes, although it is rare, the breast cancer in males is rare, but yes, there are chances of developing breast cancer in males also. So definitely males also should go for the regular self-examination. Definitely.
Okay.
Yes, it is important for males also. Definitely.
Okay. Next question, please.
Next is what is the role of PIK3CA mutation in the treatment strategy for the breast cancers?
Dr. Indu, did you get that question?
Yeah.
Okay, great.
So the question is, what is the role of P13CA mutation in the treatment strategy for breast cancer? So basically, whenever there is receptor status positive, like whenever there is the breast cancer is hormone receptor positive, and when we see that the patient is progressing, the disease is progressing on hormonal treatment, so we have to suspect certain different mutations in the tumor tissue, and one of the mutations can be P13CA. Okay, so we have to look for P13CA mutation if the patient is having resistance to hormone therapy. Okay, so that's why. So if there is a if there is a progression on hormonal therapy or hormonal strategy in hormone receptor cancer patients, we have to look for other mutations. So P13CA is other different mutation, and if that comes positive, we have some medicines available to target this particular mutation. That's why we should suspect P13CA mutation in a hormone receptor positive patient who is progressing on hormone therapy.
Thank you, Dr. Indu. Next question, please.
The next question is, should patient opt for BRCA1 and BRCA2 test or multi-gene genetic testing?
Dr. Indu, did you get the question?
Yeah, so basically,
should they just look for BRCA1, BRCA2, or they should look at multi-genes?
So it depends. See, here we are talking about only breast cancer awareness at the moment. Okay, so in breast cancer awareness, I have already discussed about the criteria to do the genetic testing, that is BRCA1, BRCA2 testing. This BRCA1, BRCA2 is a very basic genetic testing. Okay, and there is a very specific group of people who should go for BRCA1, BRCA2 testing. Okay, so as I have told you in my talk, that if there is a strong family history in the first degree relative, second degree, third degree relative, and if there is a history of breast cancer, ovarian cancer, or some uncommon cancers, and especially if the cancer was seen in young females, if there is a history of cancer in ovarian cancer in the patient, or history of breast cancer in the patient, then the chances of developing another cancer, or breast cancer, ovarian cancer, will be very high. So these are some of the categories of patient who should go for the BRCA1, BRCA2, which is the basic genetic testing. So here we are talking about only BRCA1, BRCA2 testing. But
Okay.
there are so many other genes available nowadays, which again indicates different other genetic mutations in the tumor tissue in the breast cancer patient. But we have to look for whether any treatment strategy is also available, because we know that there is definitely going to be benefit of doing the BRCA1, BRCA2 testing for different reasons. One reason is we will come to know about the chance of developing breast or ovarian cancer in the patient. We can apply the same strategy in the family members. We can advise these tests for the family members. We can advise the genetic counseling in the family members. Second thing is, there are medicines available, there is treatment available if the patient is BRCA1, BRCA2 positive. So for treatment point of view also, it is advisable to do this test, especially in triple negative patients. Okay, but other genetic testing also should be done in a breast cancer patient who is multiply treated by different chemotherapies and different medicines, different hormonal therapy and targeted therapy, and who is probably not responding or who is progressing on treatment. Then definitely one has to look for different genetic mutations also. So in that situation, definitely we have to see for other genetic mutations also.
Sure. Thank you. Thank you so much, Dr. Indoo. Any further question? We just have now 5 minutes left for the.
One more question is there. What are the chances of getting breast cancer in a female has a PCOD?
PC, PCOD.
Yeah.
So
Are they at increased risk?
PCOD, so polycystic ovarian disease, right?
Yes.
So basically, polycystic ovarian disease per se may not cause breast cancer, but if it is this condition also can have estrogen secretion, lot of estrogen secretion. So I am not saying that PCOD definitely will lead to breast cancer, but definitely one has to be very careful about the breast self examination and screening, breast self examination, and mammography. So these things have to be done in such patients. But per se, PCOD may not be the reason to develop breast cancer, but definitely they have to be vigilant also about screening.
So maybe we just have time for one more question. There is.
Now the question.
Hello.
Hello.
Yeah.
Yes.
Questions are over now.
So, ma'am, last question. I think based on Angelina Jolie's case study that you mentioned. So, what are the chances of recurrence after mastectomy?
Chances of recurrence after mastectomy. Okay. So, yeah, so I am not saying that going for mastectomy is the only solution. If the source of estrogen is present, the source of estrogen is ovaries. Okay, so ovaries are anyway secreting the estrogen. But if the breast, the organ itself is removed, so there is no chance of developing breast cancer. So I cannot say that patient will definitely develop breast cancer, because the breast are already removed. But there might be a chance of developing ovarian cancer, because if the ovaries are still intact, then there might be a chance at developing ovarian cancer. So one has to be vigilant about screening for the ovarian cancer. Definitely.
Sure. Thank you so much. Thank you so much, Dr. Indoo, for valuable time. It was a very informative session. I would definitely want my wife to see this session for sure. Thankfully, we're recording, so it would be available for others also to see this session very
Okay.
soon. We'll be sharing the link.
Yeah.
Thanks, Dr. Vivek, for moderating the event and for sharing the questions. And heartfelt thank you to both our patient survivors for sharing their inspiring story. And thank you everyone for attending the talk today and look forward to the next Precision Oncology Asia webinar. We will let you know soon. Thank you so much and have a good evening. Bye-bye.
Thank you, thank you for Hitesh and the whole team of Forbes Care, and look forward to working with you together next time.
Look forward
Thank
to
you
it,
so
ma'am.
much.
Thank you so
Thank
much.
you.
Bye-bye.
Thank you.
Bye.
Bye.